Good evening, Governor Hochul. My name is Mabel Romero. I'm a New York State licensed practical nurse for over 12 years, and I'm currently pursuing my bachelor's degree in nursing at Helene Fold College. I'd worked in three major hospitals in New York City, including Montefiore Medical Center in the Bronx, New York Presbyterian Weill Cornell, and Mount Sinai in Manhattan. During my professional career, I had always been drawn to the issues that affect our New York City youth. One of those issues that I'm currently passionate about is the prevalence of vaping in school children and high school teenagers around my neighborhood in East Harlem. Contrary to my old neighborhood in the Upper East Side, where smoke shops are limited, I've observed the health disparity that contributes to this issue in our community. I cannot help but point out that our black and minority neighborhoods have more tobacco selling shops per capita, and many of these smoke shops are in close proximity to schools. 7 years ago, I worked in a pediatrics clinic in the Bronx, and I had seen firsthand how smoking and vaping raise the chances of asthma attacks in adolescents with chronic respiratory conditions. Childhood asthma in many of our poor communities is responsible for a large portion of emergency room visits, hospitalizations, and deaths. According to a report from Take Care New York, which is New York City's health department's blueprint for a healthier life, the asthma ED visits rate among children ages 5 to 17 in East Harlem is more than double the citywide rate. During your most recent State of the Nation address, you made a proposal to introduce legislation to expand the state's prohibition on the sale of e-flavored cigarettes. I support this proposal to stop tobacco companies from targeting kids. However, I believe that the state has fallen short in its effort for stricter implementation of previous related bans. Around my neighborhood, many small retailers, like a convenience store, are still able to sell vapor devices and unflavored menthol or tobacco flavored e-liquid without regard to the age of their buyers. I see children as young as 11 or 21 coming out of these shops and hanging out on street corners while vaping. New York City implemented the first so-called Tobacco 21 law in 2014, so it's very alarming to continuously see the lack of implementation of this law. In a statement made by Trevor Summerfield, the Director of Advocacy for the American Lung Association in New York, despite receiving over $1.8 billion from tobacco settlement payments and tobacco taxes, New York only funds tobacco control efforts at 21% of the level recommended by the CDC. I propose a bipartisan bill to allocate more funding for stricter implementation of the Adolescent Tobacco Use Prevention Act and additional resources to support public schools in their initiatives to address this issue. The New York State Department of Education needs to double its efforts to implement evidence-based public education initiatives and funding to bring about the necessary changes to curb this epidemic. I'm hopeful that this bill will pave the way for my propositions. I know that this is not an issue that can be resolved overnight, but when it comes to our youth, we need to make every effort to help themselves live healthier and better lives. Thank you for your consideration of my viewpoints in this matter. With your strong and dedicated leadership, I believe that our efforts to protect the health of the most vulnerable members of our state will persevere.